I've done it. Hello, guys. Hi, Dr. Avia here. How is everyone doing? Just going to give a few minutes for people to come in so that I can share with you what I plan to share with you today. How is everyone doing? While we're waiting, let me try and share this on my personal page so that many people can access it as well through that. So give me a moment. We are certainly in changing times. I think the last time I was on here, since not too long ago, and a lot has actually changed within that time with COVID-19. But just give me a moment to share this. Hopefully I can share it on my news feed. Give me a moment. Okay, I think that's done now. All right. How is everyone doing? Wasn't long ago in January that we all said Happy New Year and everything. And within that short of space of time, obviously a lot have changed, not just, local to where you are, but actually a lot has changed globally. We are now in a pandemic, and but I hope that in the midst of all of that, that you are still keeping well and you are still keeping positive. I've wanted to do this a long time ago, actually, because I've got a lot of information that I hope I want to be able to share with you that will be helpful to you as we're going through this pandemic and going through this lockdown. But the last 3 weeks, I would say personally and professionally, has been a challenging time for me as well. So I will talk to you a bit more about that maybe later on as the weeks go by. But today, really, the focus was to just share some important information to you about how you can access healthcare. While we're going through this lockdown, while we are going through this pandemic, a lot is happening and there's a lot of information out there. We're getting bombarded with information on social media, which is not always the right thing, and getting a lot of information on the news everywhere, people telling you things they've heard or seen or not. And I guess that can sometimes be frightening. And the danger of that is that actually you can't see through and know which one is right, which one is not, and what you should be reacting to and what you should not. But as a GP, as a doctor, I am very committed to using this platform to hopefully sift through some of that information and be able to pass on some relevant information for you that would help you to get through this period in your health, but not just that really, but also in the long term, because I always say on this platform that health is a lifestyle, is part of who you are, is not a moment in time, and so hopefully some of this information will help you. So there is a lot I want to share, and I cannot do that today. So I've had to prioritize. So today's one is really just to point you to the right directions where you should be getting the right professional help in terms of your health, to get through this period. And hopefully some of the information that you gain here as well will help you later on in accessing healthcare. Now, the information I will share will be more probably relevant to people that live in the UK or live in Europe, or who have similar setups. But I hope that some of that tips and information that you will get, you can also use it and adapt it, to your own home country. Of course, you should always follow. What your government is recommending to you in your country. But hopefully, some of this information may be useful to you if you haven't thought about that. Okay, so if you are in the UK, I mean, you may have noticed a lot of changes happening in the NHS system. And obviously, all these changes are being put in place to work with the government and work globally with everyone with what is going on with COVID-19. This is a very serious infection that within a short of time has actually spread rapidly. Not only that, we're having high levels of mortality, so people actually dying from it, okay? And the speed of spread has been so great. I mean, I've never seen anything like that. And even when you speak to people that are so much older than me, they have not experienced it in their own lifetime. So we've had to put these measures in place to make sure that we are all doing our part, whether even as healthcare professionals, but not just that, everybody else is doing their part to make sure that we are curtailing this infection and doing our bit to hopefully slow it, or hopefully stop it altogether. Okay, so that's why we put these measures in place. Now, there's 3 areas of healthcare that I want to highlight that you can use to your advantage to get help. Okay, now I'm a GP in the UK. GPs, we are the family doctors in the UK. We practice holistically. That is that we deal with everything to do with the patient's well-being and health, really, from managing their short-term problems like infections and treating them with antibiotics, whether they need, whether it be just giving them reassurance, and or managing their long-term conditions like their diabetes, high blood pressure, their mental health problems, even things that social problems, So we basically get to know our patients over a long period of time. And actually in the UK, the first point of call to accessing health is through your family doctors, your GPs, okay? Now, there has been a change because of what is happening now in terms of how GPs operate now, okay? And some of you may think, oh my God, my GP is not seeing anybody now, so you're not accessing the help. What I want to tell you that yes, physically we may have shut the doors, okay, in terms of we've limited how much face-to-face contact we are having with patient, but the priority still remains, and the principle still remains that we still care to look after our patients' well-being and their health, okay? So that has not changed, okay? So your GP may not be seeing you face-to-face in terms of you sitting in front of them, or the nurse may not be seeing you sitting in front of them because of this situation we are in, but they are actually still managing all the health problems that they were managing before COVID-19 took place, okay? What this means is that we do more telephone appointments, okay, first, because we need to assess people to see whether this is something we can manage over the phone. And often, most of the time, we can do that, okay? Now, if we feel a patient needs to be seen a bit more, we might do a video appointment. Now, that is almost the same as a patient sitting in front of me, because I can see them, they can see me. The only difference is there's a screen in front of us, okay? And by that, we can even get more detail, be able to see the patient, see how they are doing, and make some clinical assessments even by doing that. And then we can manage whether we need to prescribe something. Obviously, if someone is very unwell and needs to be in hospital, going to your GP practice is probably not even the right things to do at that time anyway. And your doctor can make the right decision by getting you seen in the GP in the hospital if it needs seeing. So I want to just highlight the point that, because from speaking to a lot of people in their homes, people are sitting at home, some of them are not well, they are worried. They're worried of going to the hospital, or they think GP is not seeing anyone. They're not picking phone calls, so they're not accessing help, and that is, for me, is very worrying because you're speaking to elderly people that are home worried, are not feeling well, and they're not seeing or calling anybody, or they can't get through to 111, and they're not accessing the help they need. So you can still access your GP even though COVID-19 is going on. You need to remember that before COVID-19 started, right? People were still getting sick. People were still getting sick of infections, right? People were still getting sick of colds and flus, right? That hasn't changed. People were still getting sick of their diabetes and high blood pressure and cancer. That has not changed, okay, just because of COVID-19. So your GP is still there to deal with all those other issues. So please, if you have any urgent problems to do with your existing medical conditions or something new, please feel free to call your GP and speak to the GP. So that's the first thing that I want to highlight to you, that your GPs are still doing that. What you just need to be aware of is that even though they might be seeing the few number of people face to face in the GP practice, they're doing that at a set time in the practice. And actually, if you go to your GP's website, all that information is there to tell you when they are open, when they are seeing people, when they are not. We do have people that still might need to come in to pick up things, to have immunizations. So we're still doing immunizations because that is important. Obviously, people are still giving birth, right? Because that hasn't stopped because of COVID-19. So we still need to do our postnatal checks, if it needs to be done for high-risk groups, we're still doing baby checks. So you just need to gather the information from your GP to know what is still happening and what is maybe on hold because it's not that urgent, and still be able to assess those services. Okay, so don't just be listening to what people are telling you, okay, or what you're reading on your WhatsApp or what you're reading on the social media. Please try and get the right information yourself. And at the end of this, I'll put some useful resources that you can access so that you can get the right information from the right source. Okay, so your GPs are still working. The other thing that you need to know also, things like obviously some of our vulnerable elderly patients that were living alone, they had a care package, so they had carers coming to their house to look after them. They had support workers. Some of our mental health patients have support workers that work with them. That is still taking place. Okay, that's part of the NHS, healthcare system. That's what part of the provision of care that we give to our patients. So that hasn't changed. So carers are still going to homes to attend to those people that are living alone and sorting their medications and things. Our district nurses are seen attending to people. Obviously, we are trying to do that in a safe way. So please, that service has not stopped. And if you are elderly or you have a relative who is elderly who was having that service of maybe district nurse or carer coming in and maybe they haven't attended, it's not that it's been stopped. Maybe the person is not well, that's why they haven't come. But please get on the phone and contact the service and find out when is the next carer coming in or what is going on. And don't just assume that, because of COVID, it's not working, okay? That might not be the case, and actually likely is not the case, okay? The other way that you can also access help is through the hospital. Okay, now there's been a lot of concerns because obviously with COVID, we're hearing on the news, all we are hearing is people dying. We're not actually hearing people getting better. Okay, now I had to go in self-isolation, I think 3 weeks ago now, and I recovered, thankfully, I'm well. I will deal with in another session about self-isolation and symptoms, and I will tell you more about that. But obviously, all we are seeing in the news is the bad news. Okay, we're not seeing any improvement. And when Boris Johnson went to a hospital, I was like, God, please let him come out well, let him come out alive, because so they can be, a picture of hope for a lot of people, because we are all hearing people dying, even on our own professional platforms, people sharing, news of losses, and that can be so disheartening and that can be discouraging. And I know definitely some people will not want to go to the hospital because of what is going on. But I don't want you not to go to the hospital because you think you're doing the NHS a favor, or you think, you've been a burden on the NHS, or because we are overwhelmed. Yes, definitely we are overwhelmed, but also we are managing the things that need to be managed alongside COVID-19. Okay, so for example, the person that is having a heart attack is still having a heart attack. Okay, the person that might be having a stroke is still going to have their stroke. The person that is having cancer and is very unwell, that is still going on. And these are emergency things that normally before COVID came, it was number one. Do you understand? That has not changed. So bear that in mind. So don't be sitting at home suffering in pain, thinking, when I go to the hospital, they're not going to attend to me, they're not going to see me, I'm going to have to wait long hours. The hospital, yes, they're overwhelmed, and my heart goes out to my colleagues in the hospital. They're working so hard, but they're still, putting things in place so that people that actually are non-COVID-19 will still get the care that they need. So don't be the one to make the decision. If you need to call the ambulance because you're worried you're having a heart attack, please do that, okay? Because the ambulance, I think it'll be a sign of relief to even know that it's not COVID-19 they are going to attend to. So they will be happy to still deal with the problem, okay? So please, if you have any elderly frail patients with risk factors who are having you thinking, having a heart attack or a stroke, please, it is still a medical emergency and it will still be handled, okay? So please don't suffer in silence. The other thing that I've identified, speaking to my patients on the phone, is that people are very distressed because their clinic appointments are being cancelled. Now, obviously, secondary care, which is the hospitals, in terms of seeing specialists in the clinics. Then you have the A&E, which manages all the emergencies coming in. All right. So you've had patients that obviously were waiting to see a specialist for a problem, and then the appointments have been cancelled all of a sudden. Okay. Obviously, I know these decisions are not being done lightly. And, consultants, they take their jobs seriously, they take their patients seriously. And I'm sure, and I know, because having known a relative who needed to see a consultant, they've gone through that, and it's difficult. They're making tough decisions. So when they cancel appointment, they're not canceling it, or on a flimsy way. They've actually assessed the situation and decided whether this is something that we can manage later on or something that needs to be dealt with right now. Okay. So yes, your appointment may have been cancelled. You may not have been given a date yet, and that's because we don't know how long we are in this for. How long it's going to take, and we need to make sure that we are using the resources, the limited resources that we have. We're using it the right way. Okay, so that is why, and also to reduce the risk. Because every time lots of people are going into the hospital unnecessary, we are increasing the risk to the sickest patients in the hospital, but also to our colleagues who are working so hard, and our team, the doctors and the nurses and the other staff, key workers in the hospital who are doing their best, risking their lives every day to make sure they are looking after these sick people. So that's why they are canceling appointment. But please be reassured that things are being put in place to make sure that we mop up those backlog. Though we can't tell you how long that's going to take, but be reassured. Now, that's more reason why you need to make use of your GP. Because if, for example, you are in pain, maybe you are going to see the specialist because of your knee pain, because of your arthritis, and they were thinking about knee replacement surgery, that is obviously on hold now. You are still in pain. You should not suffer in pain. Get on the phone to your GP, because your GPs can still prescribe medications for you to try and manage your symptoms until you are seen by the specialist. Okay, so that's something that someone needs to know. The other third very important people that you can make use of during this time is the pharmacist. I mean, as a GP, I love pharmacists because they support us greatly in their to support the GPs, not only the GPs, but even in the communities, in the nursing homes, they support in the hospitals. Pharmacists are wonderful because they know a lot about medication. That's what they've been trained to do. They can advise you about your medicines. So even when you can't get through your consultant, you can get through to your GP, and it's about medication, about side effects, about dose, about what I'm on. I'm not sure whether I should still be taking this. Your pharmacists are well equipped, very knowledgeable to advise you about your medications, and they will tell you if they still want you to talk to your GP. They will even tell you, ring your GP after this and speak to your GP as well. So make use of your pharmacist. Not only that, particularly in this situation where, going to the hospital is limited or seeing your GP is limited, self-care is so important. How you look after yourself. This is when you need to take ownership and responsibility also for your health, and self-care is important. And one of the pharmacists can even help you with that. So sometimes you might need to go and get some over-the-counter medications like paracetamol. Your GP does not have to prescribe that for you. You can easily access it through the pharmacy. So you can get that. Your pharmacy can also even advise you what other things you should take if they think, oh, this is a cold symptom, this is a flu, or this is just for, you just need a bit of painkiller, you'll be fine. If there's a rash, they think you can apply some cream, they will easily and happily advise you. So please assess your pharmacist. And, talking along the side of pharmacists, if you are on regular medications, i.e., maybe you're on blood pressure tablets, which you need to be taking regularly, or your diabetes medications, which you should be taking regularly, please try and be proactive. Don't leave your, way to your tablet. You've only got one tablet left. Before you now remember, oh my God, I've run out of tablets. What am I going to do? That stresses you out more. That's not good for your health right now. Okay. So make sure you are proactive. You are thinking ahead of time. Make sure you put in your request in maybe ahead a week ahead to the pharmacies. Also, remember that gives the pharmacies time, because at this time they too are overwhelmed, they're overloaded with jobs that they didn't have to worry about before. On top of that, also they have limited opening hours. Okay, so they don't need a whole thousands of prescriptions to be going through. When they have limited time. So if you are pacing yourself and everyone is doing their part, that would help them. But make sure you're putting your request in advance, so that they have time to work on it and get it ready for you, so you don't go periods without tablets. As GPs, we have worked with the pharmacist. We've made sure that, repeat prescriptions, we've set it electronically. So we do it, your pharmacist will get it, and you'll be able to just pick it up. Now, if you are maybe in self-isolation with yourself, or maybe with your families, so you can't go out, delivery systems are in place now. The pharmacist can arrange for your medications to be delivered to your door. So these are all things that are in place now. Maybe, even if you are, in other countries, this may be happening, but this is something for you to also think about, that if you're on regular medications, because every time that you are stepping out of your house, okay, you are risking exposure, because definitely you are going to meet other people on the way. You are going to meet other people, and you're going to have more contact with people, and that's what we're trying to reduce. That's the whole idea of lockdown, the whole idea of self-isolation, of social distancing. So every time that you are going out, whether even for medicines, for food, for whatever, you need to be thinking, do I need to go? Is there another way I can sort that out? And definitely with your medications, if you're on regular medications, we can get it delivered to you. So make sure that you're communicating with your pharmacist, so that you can use that service, okay, to your advantage. And I hope that helps. So today, I'm going to leave it at that. The other services that are still running is the out-of-hours service. So out-of-hours service is run by GPs, actually. And usually when GP service practices have closed at the end of the day, out-of-hours services kicks in. Sometimes they do that in the daytime as well, but mostly it will be after the end of a GP practice day. That picks in. That is still running, so you can still have access, okay, for urgent needs, for your health. Walk-in centers are still working. And now we also have hot clinics, what we call COVID-19 hot clinics, and it's run by GPs. And these are centers, that GP services are working together and have put together in different boroughs, okay, to deal with suspected COVID patients. So, for example, if your GP speaks to you on the phone, and actually after what you said to them, they were worried that some of the symptoms you have may be COVID symptoms, they can get you booked in some of these hot clinics, which then you'll be seen by a GP. They will assess you face to face, and you'll be able to then move on. If they're obviously worried, they will send you straight to the hospital, or if not, they will guide you and advise you rightly, and then send you home. So all these things have been put in place. So there's a lot of information. So don't suffer in silence. If anything at all, please don't suffer in silence. The services are still running. NHS is still committed to looking after and maintaining the health of the population, okay? And that has not changed, okay? Our way of practicing has changed. As a doctor, I've learned now to do video consultations with my patient. The first time I did one, the patient was shocked. I was shocked. I said, hello, but we managed it, okay? So, we are all doing our best to help the situation. So you to do your best. Make sure that as you are home, you're looking after yourself. One thing that you can do for yourself is actually learn to switch off, okay, all the bad news, okay? Don't be watching them every minute. There's some useful resources. You can go to the World Health Organization website. Obviously, they are putting the dots together globally, picking up information from different countries of what is happening, the trend of COVID-19, and giving advice and updates for us. So that's a good website for you to check it out and get the right information. nhs.co.uk. Even if you don't live in the UK, that's a wonderful website that you can look at. It has all the information. It will guide you on symptoms. It will guide you on what you do, what access you should get. So that's a useful information. The government, is doing its best, and you can go to .gov.uk, and that's also there's a wealth of information there. And now I'm sure even if you Google, Dr. Google is also there. Even if you put COVID-19, trust me, you'll be overwhelmed with so much information. But before you do Google, make sure that you do all the reputable right sources first, okay, before you go there. But yeah, the information is there. So please, today I just wanted you to have that information, because I'm a doctor. So the first thing I'm going to tell you is how to access medical care, right? But there's so many other things that I'm going to share with you as the days go by. So yes, please keep well. And the last thing that I would say is that I know that we've all been overwhelmed so much with everything that is happening. We've been so overwhelmed. This hasn't, most of us have never experienced this before, and we are learning, okay? But, I feel that sometimes when things like that happen, that leaves us speechless, leaves us, not sure what to do. It's affected everyone of every level. It's affected our prime minister. It's affected, people in leadership. It's affected even the monarchy. Our beloved Prince Charles was affected by this. It's affected, the rich, the poor. Anyone has been affected by this. Now, it should make us think, and sometimes when things like that happen and we're overwhelmed, we don't know what to do, because science, doesn't have all the answers. Doctors, as a doctor, I don't have all the answers. Pastors, we don't have the answers. And, everybody, we don't have, we're just all working together, and we're pulling our resources together, which is fantastic. It shows that we are very resilient in these situations. But I also think that when things like this overwhelm us to such a degree, to a pandemic, to a global level like that sometimes we need to look up and seek strength, from above. For me, one of the things that has really helped me is my faith. My faith in God has really helped me in this situation. And I just want to speak over someone, who is in distress, who is in a lot of anxiety, a lot of panic. You may even be sick, right now on your sick bed, and you're just afraid and you don't know what to do. And you might be listening to me, and I just want to speak encouragement over you, and I just want to speak peace over you, really, that even in the midst of this storm, in the midst of this chaos, we're not sure what is happening, that somehow you will have an inner peace. You will have an inner calmness, and you still remain positive mentally, and you will have a hope that you will come out of this. This will pass. There has been other pandemics, and that's life. Unfortunately, there's hard times and there's good times, and it seems we are going through the hardest of times right now. But I just want to tell you that you are strong. I am strong. We will come out of this. Yeah. And there is someone up there. I call him God, and he's watching over us, and he will help us, give us the strength, even as to our doctors, to our nurses, to everyone, to our elderly and frail people, God will strengthen all of us, and somehow we will come out of this and on the other side, and we'll be able to tell our stories to our children someday. All right, so take care of yourself, and hopefully I will tune in again tomorrow, because I've got something important to share with you. So thank you for listening. Please share the clip with other people so they can get the information that they've missed. All right, thank you. Take care of yourself. All right,